I'm Dr. Alan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and tri-state community. Today's topic is occupational medicine or work-related injuries. What do you do if you're injured at work? There's so many of us who work so many hours a week, and so many times we do get hurt. What rights do you have? My panelists tonight, I'm happy to have, and wonderful people, is Christopher Monterosso, who's an attorney who specializes in occupational law, workers' compensation, and work-related injuries, and Joe Saraceno, a physical therapist who does a marvelous job taking care of patients in the physical therapy domain. The number of people who are injured at work is huge. One statistic that I saw was that over 3 million people were affected in the year 2015 with work-related injuries, and they lost over 900,000 days of work. What are your rights? Who do you call? How do you get care? Who pays for the care? And these are all interesting questions that someone who as a neurologist and all other specialties of medicine really have to deal with. Patients, people come in all the time saying how they were hurt at work. And that's what we're going to talk about on today's show. So first of all, I have you and Joe is a marvelous physical therapist, Joe Saraceno here, and he's going to tell us a little bit about what you could do at work to try to make your environment better in order for you not to get hurt. So I'll let you start a little bit.
Well, you know, the first thing we like to do, we treat a lot of our patients just like we treat even local athletes, and what we try to get them to do is to prepare their bodies for their jobs. You know, a lot of people don't realize that postural imbalances, muscle imbalances, joint mobility, stiffness leads to injuries, especially repetitive stress injuries when you're doing similar tasks day after day at work. And those tasks could be something as simple as a desk job, or as laborers, as a construction worker, or an athlete who's a professional athlete. It's still their job. So we like to get people to understand that they have to prepare themselves to do the job that they're doing on a daily basis, because a lot of times, you know, you hear things, oh, sometimes it's just the simplest activity at work, a simple move, oh, I just bent over to pick up a pencil and my back. Or, you know what, I sit at a desk day after day and I'm starting to get pain in my neck. It's just really nagging on me. Or I'm a bus driver and you know, I'm starting to get back pain from driving in the bus. So we like to prepare patients, prepare people for their day at work when they come in as patients. We try to convey that message to all of our patients just to prevent these injuries at work. And then as far as what you can do at your workplace, you know, there are some things that, you know, some measures that you can take to try to prevent some of these injuries. We talk about mechanics with lifting. So if you have a job that requires heavy lifting, we talk about, you know, using proper body mechanics in order to prevent injuries to muscles in the back or in the neck or in the shoulder. And then sometimes we talk about posture, and we discuss, you know, even for somebody who's sitting at a desk, what's the proper seating arrangement as far as your computer screen, talking on the phone, maybe using a headset, the gel pads for somebody who's on a computer, or things of that nature.
So it's not just for people who are doing physical work, or you think about labor or jackhammers. Those aren't the only people who get hurt at work.
No, not at all. In fact, you know, the seated worker, the sedentary worker, the person who sits at a desk is almost more likely to get injuries than somebody who's more active, because the active person, if they're doing it correctly, they're active every day, they tend to be in better physical condition. Sitting is a killer, and we see it a lot with our patients.
So you almost have to work out in order to do your job.
Absolutely.
And if I could ask you while I have you here, is there any exercises you could do in a seated position that would help people, or do you recommend people stand up every 15, 20 minutes?
Well,
what would you say to someone who's really sitting most of the day, especially with so many computer programmers and people doing clerical work? Yeah,
the computer is really taken over. I mean, it's really taken over a lot of work occupations, and people rely on them on a daily basis. You know, the one tip that I give to everybody with posture is just be as tall as you can be. It sounds so simple, But if you sit or stand as tall as you can, you're using good postural muscles that help to stabilize very important areas like your spine to prevent some of these injuries. So I always tell people, listen, whatever you're doing, whether you're driving in a car or sitting at a desk, if you have that seated kind of work environment, you have to really, really think about your posture whenever you can.
So everybody at the panel, we all sit
Yes,
up a little
we
bit
all
better.
stand up, yes.
You have
Very,
to be in
very important.
proper position is
Yes.
very important. Now, to Mr. Monteroso, who's our attorney here, who's going to help us a little bit navigating the system. How do you know if you're hurt at work?
Well, it's kind of a larger question than you might imagine, but the simple rule of thumb is if you're in the four corners of work, if you have clocked in for that day and you're hurt, and whether it's something more dramatic, for instance, if you had dropped a hammer on yourself, or if it's something that's long simmering, like a repetitive stress injury, something like carpal tunnel syndrome that you developed over time. All of those things count as work-related injuries. In fact, there's really only a very small amount of things that wouldn't count as workers' comp. Those very select few things might be if you had a faint out of nowhere and you fainted at work, that might not count as workers' comp. But basically everything else, regardless of who might be at fault, counts as a workers' compensation injury.
So when someone gets hurt at work, what do they do?
Well, a number of things need to happen. The law says in the first 30 days, you're required to give your supervisor notice of an injury. And the law is cognizant of the fact that people are not always aware of who they're supposed to tell and how they're supposed to tell them. So you actually get up to 2 years to report your injury if there's a reason for it. Like you didn't understand that it might be a workers' compensation accident, if you did it wrong, if maybe you went to the wrong type of doctor and used your private insurance, that can be excused up to 2 years. So the general rule of thumb is you always try and tell your supervisor if you've been injured at work, and you should always try and fill out an accident report with that supervisor. If you're in a more physical job, there's usually someone to tell. For instance, in factories and things like that, there might be someone called a shop steward. But if you're in a more sedentary job where your supervisors might not be very used to reporting a workers' compensation accident, always try and get to a supervisor and make sure that you filled out an accident report.
You mentioned it before, but just to reiterate, someone who does repetitive type things, that's also considered work-related?
Absolutely. If the workers' compensation system is supposed to give you medical insurance whether you've gone out of work or stayed at work, and taken care of you and kept you at work for as long as possible. So for instance, if you have taken the sedentary job and you had developed carpal tunnel syndrome over time from typing at your computer, the workers' compensation system is supposed to give you the medical coverage for that carpal tunnel syndrome forever, regardless even if you've changed jobs later on. So this system is supposed to encompass all things that are work-related.
So say someone is hurt at work and can't continue. Do they lose their job?
It can be possible. Most jobs will be preserved for a number of months. And if you're in a union, it could be preserved up to a year or 2 years, depending on your contract. After a certain point, your employer no longer has to keep your job open if you're unable to do it. But for the short term, your job is absolutely open. And most employers will try to accommodate you and bring you back to work, because the whole purpose of the workers' compensation system is to try and return you back to some level of gainful employment.
So just to go further with that, say you were a jackhammer, and now you could do some other means of work. You can answer a phone.
Right.
Do some employers bring you back in a different capacity, or is that something that's unusual?
Yes, that is something that is seen, but a couple of things can happen. Whether or not you do it through your own employer, you can sort of do this on your own, and let me explain. If, for instance, you're working at as a jackhammerer and you made $50,000 a year, and you got a new job through the construction company making less, part of the workers' compensation case is to compensate you for the difference in your old and new job. Now, whether or not your company takes care of you if perhaps you had to take a new job, perhaps you went from jackhammering to being an administrative assistant, that's okay. The law is still supposed to take care of you for the difference in your old and new salary. They want you to try and be as productive as possible within your restrictions, and they want your lifestyle to not be sort of disrupted as little as possible.
So we do have a lot of rights, and we're going to get back to them a little bit. So I'm going to go back a little bit to the medical aspect. So if someone's hurt at work, and you get a call, I get a call, somebody that you know professionally, personally, what I tell them is, if I got that call, I just fell, I just hurt, I just fell off a chair, I just hurt myself on construction. First aspect is getting someone better, and not any of the legal aspects and anything like that, or even reporting it. It's getting better. So who do you tell to go to the hospital? Who do you tell to go to their urgent care center? Who do you tell to go to their regular doctor? Do you tell anybody just come in and we'll see how you're feeling?
You know, I think it's a judgment call that's similar to any type of an injury. You know, if you get injured at home, you assess the situation and how serious it might be, and you make your decision on what kind of medical help you might need, whether it's something that's urgent or something that can wait a couple of days. You know, we get that question a lot, and people are aware of what I do. Sometimes I'll get calls and, who should I see? What should I do? And the answer pretty much stays the same. Are you in a lot of pain? What kind of inflammation or swelling? Do you think you broke anything? I mean, are you able to stand or walk or do anything? If you're really limited functionally, you need to get to some medical help immediately, as quickly as possible. Sometimes with the more traumatic injuries, it's a lot easier to say, you have to get me to an emergency room very quickly. If you broke something or you feel that 10 out of 10 pain and you can't move, you should get yourself to an emergency room. But sometimes it's not always that evident what type of pain you're dealing with. Like Chris had said, sometimes, maybe it'll go away tomorrow. Maybe it's just something, it's not that serious, and then it lingers and it gets worse. And it's good that some of these laws are in place that gives you time to assess the situation and still consider it to be a workers' compensation case. But just like any other injury, you would probably assess it based on the severity of the injury. If it's something physical, you would probably see an orthopedic doctor or a neurologist, and to see how serious or not serious the injury might be.
And those are the two big forms. I mean, if you think about it, people injured at work or an injury to someone, it's always either a joint,
right,
a bone, a nerve,
yes,
a pinched nerve in your neck, your lower back. In my field of expertise, I'm like a concussion where you're hitting the head. And many jobs that you'd be shocked. There was a firefighter who had pliers hit him in the head. From 8 feet, they fell in his head and he had a concussion. So you say to yourself, how did that happen? And it didn't even happen at a fire. Right. But it happened during work, and he was left with some residual problems for months of not being able to think clearly and was feeling very dizzy. So there's a lot of different places that this could occur. And I think, as we said before, the first thing and the most important thing is, if you're hurt at work, is seek the proper medical attention. I think I'm seeing way too much in my practice people who dismiss their symptoms. They said, well, it's nothing. And of course, and we're not talking about even the law and the rules of workers' compensation, where it can be a day or two, a month, or even 2 or longer before you declare it. But it's basically just for their health, is getting to the right person. You don't want to walk around with a fractured leg. You don't want to walk around with a herniated disc, right, and not treat it. You don't want to walk around with the concussion symptoms. So if you don't really get the proper treatment, it's going to take longer for you to get better.
Yeah, there's no doubt about that. And we see a lot of times when people neglect certain injuries, it snowballs into other injuries, because now you're compensating for this knee pain that you thought was nothing, and now all of a sudden you realize you're getting back pain, and you think, well, the two aren't related. Well, they probably are, because you probably compensated for your knee pain, and now you're developing back pain. So yes, the important thing is to seek the proper medical attention as quickly as possible, and not to, like you said, ignore these symptoms when they occur.
There was a famous baseball player named Dizzy Dean who broke his toe, and he altered the way he pitched, and then his arm went.
Yeah.
You know, in
see
in
it
its
all the
prime.
time.
So it
See
does
it all the
happen.
time,
It
yep.
does happen. So there are stories like that. So back to you, Chris, a little bit. What if you hurt something that's already been hurt? Does that count? Or say I've had a bad back from playing baseball when I was a kid, and then I do something at work and I bend down to pick something up and it gets worse. Does that count as something new, or is that just something a recurrence of something old?
It absolutely counts under workers' comp. If you're doing an activity at work that injures you, or even if it's repetitive and you have an old problem, if it's come to life or it's been re-injured, that absolutely counts as workers' comp. And one of the first things that you're asked on the state-given forms on workers' comp is, have you had similar injuries in the past? And whereas in other fields that might have more significant, in workers' comp, they just ask you to sort of disclose it, and you give them basically a HIPAA release. And if they want to go look for those older records, you've disclosed it. That's basically all your responsibility is. You have to be forthright about your prior history, but it absolutely does not bar you from claiming injuries in the future.
So let me ask you a general question. Someone's hurt at work. When do they consider getting an attorney to help them?
Well, you can get one at any time in your case, even if they're many years old. It helps you to get one earlier because it is a complicated process. And you may or may not be missing out on what your real rights are. And if you didn't know that your employer might accommodate you, or that the law protects you if you got a new job with a lesser salary, you might be missing out on a lot that could make your quality of life a lot better. And most attorneys in this field work on contingency, so just asking an attorney...
What does that mean?
By contingency, I mean that they're not paid up front. And if they find money in your case, they normally get a percentage of it. And most attorneys in this field work on contingency, so you're not losing anything by speaking to an attorney as early as possible. It's basically a free conversation with really any attorney who works in the field about it, and it doesn't harm you. And if you come to some realization that your case is so simple that you don't need an attorney, that's okay. You're not necessarily tied into one at that moment.
In your experience, do most people need a lawyer?
Well, yes, we do see that there are problems associated with it because one of the common misconceptions in the law are, once I go back to work, am I still allowed to go for treatment, physical therapy, go to the doctor? Yes, and of course you are. And that's something that, in my experience, that I've found out that people don't realize until they've spoken to us. Or things about accommodations, or things about perhaps some sort of settlement later on, they wouldn't know unless they spoke to someone. And certainly your employer might not tell you.
Thank you, thank you. So back to rehabilitative therapy. What a broad term. Someone gone through their diagnostic test, we say they went to the emergency room, they might have gone to an orthopedic surgeon, fracture, knee problem, hip problem, went to a neurologist, maybe even went to a neurosurgeon, have herniated discs, all kinds of words that we hear. As a physician who takes care of a lot of those kinds of problems, sometimes the end result is there's a prescription that's written to go for rehabilitative therapy. And what is rehabilitative therapy, and how do people get better, and what modalities are there? I mean, we know about physical therapy, there's occupational therapy, there's acupuncturists, there's chiropractors, and they're all certified, sanctioned by New York State, appropriate things, appropriate specialties. Is there any, as a physical therapist, what are your thoughts about the different specialties? Is there any time when one might be better than the other, or if one doesn't work, maybe to try a different modality?
Well, I could speak as a physical therapist. A lot of the injuries that we see from workers' compensation cases are your typical back injuries, shoulder injuries, extremities, and things of that nature. With occupational therapy, I know in our field, with the orthopedic field of physical therapy and occupational therapists usually handle hand injuries, a hand, elbow, those types of injuries, where fine motor is really limited. So sometimes the occupational therapist would be a more appropriate case for somebody who might have carpal tunnel syndrome or might have arthritis of the joints in the hand or something like that, or maybe a crush fracture of the hand. Usually those patients go to see a hand surgeon or a hand specialist and then get referred to a hand therapist. A hand therapist could be a physical therapist, and quite often it is an occupational therapist. For physical therapy, like I had said, a lot of the cases that we see are typically your herniated discs. You see a lot of that. You might see some fractures. You might see some ligament tears in the knee or the hip, labrum tears in the shoulder or rotator cuff injuries. What we do with rehab in that case is we really try to assess the situation between acute or subacute. You know, if this is an acute injury, you know, you really just want to get the inflammation under control and try to get the patient just feeling a little bit better before you start to do things that, you know, you're thinking about getting them back to work. You're just thinking of getting them in the car and getting them home. So you really have to assess the situation as to how severe and how acute the injury might be. Quite often with physical therapy, it's usually a subacute, where we see the patient, you know, maybe a week after the injury. And in that case, you're starting the process already as to, you're thinking in the back of your head, are we going to get this patient back? Are we going to get this person back to work? You know, what are our short-term goals? What are our long-term goals? And usually that goes, you know, work hand in hand with the patient and the physician that might be referring the patient to try to figure out, okay, after a couple of weeks here, I'm starting to see something that we think we can get this patient back to work. Or, you know what, we're going to need a little bit more time to assess the situation. This is a little bit more severe than we might have thought.
Tell me about some of the other modalities, chiropractic, acupuncture. Are there any portions that you think that if someone doesn't do well with physical therapy, what do they do next? I mean, we send patients sometimes for surgery and for pain management,
Right.
But even in the modalities of rehabilitation, that whole umbrella, are there times that a chiropractor you think might benefit a patient or acupuncturist might benefit a patient?
Well, as rehabilitation specialists, we do the same thing. You know, I'll refer a patient sometimes if I'm not getting as much as I'd like to out of the rehabilitation. I might refer or just say, you know what, you might want to give acupuncture a shot.
Mm-hmm.
I've referred some patients to acupuncture. I've referred some patients to pain management. You know, we work hand in hand with pain management and some chiropractors as well. I think as long as everybody has the common goal to make sure that the patient is getting better, you know, it can be a very good mutual relationship between health professionals to have a common goal.
I think something that you said was so interesting earlier, that you have to train in order to be able to do your job properly, whether you're an athlete or whatever we do. And it's interesting because many times I have people who come in who've had various injuries in their life who I'm asked by the police department or the fire department, do I think they can go on and become firefighters and police officers? And I think one of the most difficult things is to tell someone before they start that line of work that there's a reason that they can't, because of a large herniated disc, because of nerve pain, because of all kinds of other things. Have you noticed, and maybe give me if there's any anecdotes, people that you've told not to go back to work who've done well, or even and more on the positive side, people you've told you've gone through your rehabilitation and really have gone back and gotten to where they were before?
Sure. I mean, I think you have to kind of consider what the job entails. You know, I'm not sending a police officer back to work unless he or she is 100% ready to go back to work and do what they were doing. I'm putting their life at risk if I say that, you know what, I think yeah, sure, you're ready. You know, I'm not going to do that. Firefighters, you know, things of that nature. I'm not, you know, and any therapist worth anything would definitely say the same thing, and physicians as well. You know, you have to consider what their job entails and what they're going back to do. You know, some of the more sedentary work jobs, you know, that we think people can get back to, sometimes that's a little bit easier of a decision. But the more difficult decisions definitely occur with occupations such as a police officer, a firefighter, where, you know what, if I say, yeah, you're ready, and then they go to apprehend somebody or go into a burning building and, you know, their leg gives out, you know, you have to be 100% sure that this person is ready to go back to that type
Just
of
like
job.
we talk with professional athletes. I mean, the job is really at
Absolutely.
that level. So Chris, we were talking before about some examples of things that you've seen as a practicing attorney. What kind of strange things have you been able to help people get through situations?
Well, we've seen a lot of success, especially lately, with retraining. We've seen a lot of success with speaking to vocational counselors, people in their own community, things like Veterans Affairs departments, and a lot of people have been able to retrain for other types of work. But one of the other things that is sort of a sadder thing is that these injuries sometimes come back to life, and in a workers' compensation case, it can be up to 18 years later, where someone might have hurt their back in their 40s, and then in their late 50s, they wake up one day and their back isn't working the same way. And then that case can carry them later on in life. And so when we see those sorts of things, if you have a good understanding of the law and the way things are going, you know, people's quality of life isn't totally ruined.
Is there a difference between huge companies, city workers, versus, say, a mom and pop shop where there's 3 people in the place and you get hurt there? I mean, what difficulties, what differences do you see, and what do you have to do differently?
I mean, legally speaking, there shouldn't be a difference, but I think practically there is. I think we see in larger places that, like city work or in a large corporation, that there's more of a hierarchy to reporting an injury, to understanding what to do with, you know, how to take care of you and giving you accommodations later on. We see with smaller companies that places will work either very hard to get you back to work, or they feel sort of put upon as if that this is some sort of large legal proceeding that's happening to them, so they get very defensive. So in both scenarios, your legal rights are the same, but sometimes the outcomes are very different.
Very interesting. I want to thank both of you for being here. I have to say, what an interesting conversation. Being a neurologist, I see patients who have been hurt at work in different ways, and some of the intricacies of the system make it very difficult for both the doctor and for others. I mean, the idea of what they can do, what they can't do, who I have to ask permission for. Our goals are all the same. It's to get people working, getting people back to themselves. We want people to get back to their baseline status. And through your help with the legal system, and they're actually judges that help. So this is not an arbitrary person who decides yes or no, you're injured, you're not injured, what tests you can get.
Right.
There's actually a judge who looks at these cases. So you really have the fairness of the whole court system with relation to that. And that's something that I think I'm very proud of and very happy to be part of in New York State, that we're able to do it. And with marvelous physical therapists and great doctors around, we're really able to get people back to where they were many times. But if they can't, there's a lot of rights that they have. And that's what's so important about knowing your rights.